everybody, it's Dr. Off. Now we are talking about topic 7. So this week we're going to be talking about assessment of school age language disorders, and also just heads up, I said it in the announcement, but these next few weeks are going to take some kind of forward planning because now we're getting into the simu cases and the clinical clock hours. So make sure get in there as soon as possible, start working on it as soon as possible because those normally take a few hours, like in addition to the other course assignments that we have. And then also, I'll make a post on this as well. But you're gonna, even though the due date is not until, for example, this first one is not until November 5th, we're having the debrief on November 3rd. So you want to be, if not completely completed by then, um, all but completed by then, so you can participate in the debrief. And in the future, I will maybe kind of put it a little bit closer to when the assignments are already complete. But for this one, I just wanted to kind of make sure we were in that 2 week window, which is why I picked the November 3rd date. So just have that in your mind because the whole point of a debrief is that you have already done the work. And now we want to kind of reflect on what you enjoyed, what came easy to you, what was difficult. So just kind of keep that in mind as you're going through the simu case. Um, Another thing too, just to kind of like watch out for, when you're doing the simu case, make sure you're not only like watching kind of the videos, the blanket videos as they come, but when you click on, you'll know what I mean when you go in there. But when you click on the different selections and options, all of that in the kind of six main categories, when you're clicking on the selections or options when you're making your choices, they will provide you additional information about the student. So it's not just those kind of like 30-second videos in like, for example, the case history assessment, the kind of the main buckets. But when you start looking at all of the different options in each bucket, there will be additional content. So make sure you don't miss that because that's a lot of that's crucial information for determining what's going on with Dion. All right. Okay. So hope that is going well for you guys and good luck with that. So for this week, we are learning objectives for the assessment of school age language disorders. Our objectives are like how to apply evaluation approaches for communication disorders. And of course, we're looking at that kind of school age language disorder. So apply evaluation approaches for communication disorders either in the schools or in clinics for school age children. We'll compare assessment tools and also evaluate evidence-based practices of assessment. So overall, school age language disorders, when we're assessing that, it involves identifying child's language skill support needs for classroom and everyday communication. We're also looking at that severity because that's what's going to tell us, whether they're eligible for different types of supports. And do not forget, and I'm going to say this probably about 6 times throughout this little mini lecture, that also includes social. And a lot of times, if you're in the school setting, they're so hyper fixated on academics that, if a student is borderline and it's, not affecting their academics, then they'll say, oh, there's no need. But if the child has no friends and doesn't want to come to school and feels very isolated and quiet all the time, that is a justifiable need under IDEA, our special education law, to qualify a child. And you might be the only one who knows that. Administrative teams and intervention teams often forget that that's a qualifying factor. So keep that in your mind because social is, as you know, thinking back on your own childhood, social is just as if not more important than academics when kids are spending the majority of their life at the school environment. Okay. Okay, so for purpose, why are we testing? Just kind of went over that, but understanding difficulties using language that impacts learning, social interaction, and academic performance. So in language, school age language, what are we assessing? We just recently went over receptive and expressive language. So of course we're assessing those. Receptive language, understanding vocabulary, sentences, directions, and more. Expressive language using words, grammars, grammar, sentences to communicate ideas, um, pragmatics, that's that social communication. Are they able to do turn taking? Are they able to do topic maintenance? Can they express their emotions? Can they ask for help? Can they initiate with peers appropriately? Are they a little off to the left and maybe they're standing too close to peers or saying inappropriate comments? Is it affecting peer relationships? That's pragmatics. And then meta linguistics, the awareness of language structure, thinking about language. And so this is really important for reading, writing, comprehension, that kind of stuff. So assessment methods. We've talked about this a lot, so this should be kind of a review for you guys. But we are going to look at the case history. Just a quick little, overview of development. Does anything do any developmental delays run in the family? Was there anything they should be aware about from like the preschool years? You can ask about birth history. Oftentimes we do look at that. We want to interview teacher and parents because we can get really crucial information from both parties. We do need the standardized tests to compare skills to age norms. And again, that's a required element. You will need that whether you're in clinics or in schools or anything that requires insurance or government funding. And then we want the language samples, which are going to help us with conversation, assessing their ability of are they able to converse, have back and forth conversation, storytelling, writing, and conversation is big because not only does it show us their like grammar and language structure, how long does it take them to respond to a question? Do they need to be prompted to respond? But also, how are they responding? Because that's kind of like that expressive language component and receptive. Like you said something to them, or did they respond to you? Did they understand what you just said? But also, how are they responding? Are they responding, but it's off topic? Because that's pragmatics. Are they hyper fixated on a single topic? You just asked them about the school bus and they said, yeah, 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 great. So, anyways, Pokemon, blah, 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 blah. And they keep coming back to Pokemon. Okay, now we're looking at maybe a social difference. Like that's a hyperfixation. Now, every child is within reason, right? So every child wants to talk about what they want to talk about. But if it starts to become more apparent at the severity. So if they can only talk about Pokemon, or if they answer every question with a brief, yeah, okay. Anyway, so Pokemon, and then they kind of come back to it. It's like, okay, now this is starting to be a little atypical, right? Um, then there's our curriculum-based assessments to see how language difficulties affect the classroom tasks. And then there's dynamic assessments to measure learning potential and response to cues. So dynamic assessments is an interesting one. I know some people talked about this. It is great. It's interactive, but it does not replace the need for a standardized test. It is a supplemental support. It's great. And it's especially good for our kids that maybe we're trying to tease out if it's a language difference or disorder. But it is a supplement. It does not replace the need for a standardized test. So we're evaluating the child's ability to learn language and communication skills when you give them a support, rather than just measuring what the child already knows. Because if any of you guys have ever witnessed a standardized test, it is very structured. You're not allowed to deviate from the script. It has been norm referenced on how it is written. And you might be able to say things that you're not even able to, you actually shouldn't be telling them if they're correct or incorrect. You should have your poker face on and you can give them little encouraging, um, maybe moments of like, oh, good working, or maybe if you notice they need a little brain break, that's fine. But other than that, you have to stick to the script. Dynamic assessment is different. This is where we're kind of like, okay, cool. We have our interviews, we have our case history, we have our standardized assessment scores. Now I'm the therapist. I'm gonna do a little mock therapy and see how you respond. Do you respond to scaffolding, modeling? Maybe I give you a sentence and you finish the sentence. are you able to show me more when I offer you a little bit of support? So this is that kind of like test, assess the initial skills, teach, provide cues, prompts, and teaching, and retest, see if the child improves. So this is really good. A lot of times, not only will you see this in the assessment process, but you might see this in like the RTI, response to intervention, or MTSS, which is that kind of like, okay, we've identified that the child needs support, but are we assessing yet? Do we definitely know they need an assessment in speech therapy yet? Let's find out. So you could even potentially use this type of dynamic assessment at that kind of tier 2 response to intervention model, like when you're still deciding, does does the child need to be fully assessed, or is this just something we can maybe, teach the elementary teacher some handy dandy tricks to kind of scaffold them in the classroom, and maybe actually that's enough. Um, or maybe another great reason why we use dynamic assessment is, we already know the child's going to qualify, but deciding the child qualify isn't enough, right? When we test a child, not only do we write up an evaluation and give scores, but we also write goals and a treatment plan. So dynamic assessment will be really great for that treatment plan component when we're trying to decide what interventions will most likely work with this child. What type of prompting and cueing should I maybe, what verbiage of prompting and cueing should I include in my SMART goals for either the clinic or for the IEP in the school system? And then also, it's really great for students with diverse and culturally different backgrounds, because again, it's kind of like helping you to tease out, okay, is this a language difference, or is it like a true disorder? Even with me scaffolding, I'm seeing that it's actually not their second language that's the problem. They really, really are struggling with these like grammar components and comprehension components. Um, okay, so let's see. Oh, so in short, dynamic assessment shows how the child learns, not just what they know. And then just again, like kind of like a brief overview, standardized tests show what the child currently knows, but dynamic assessments show how a child learns and why difficulties are occurring. So it's a great addition. So for the goals of assessment, what are we trying to achieve? Um, we're obviously looking for strengths, weaknesses, educational impact, language difficulties. We are seeing if we need to provide a diagnosis, if they need individualized intervention. And then, of course, we're also looking for severity because we need to see if they qualify. And again, this is my friendly reminder, and social impact. This is why the language samples and the conversation samples are so important, because this is something, it kills me. Some really good SLPs in the schools, they kind of leave this part out, and that social impact piece can be really detrimental to kids. So you cannot forget the importance of that. Okay. So in short, SLPs assess school age language by combining standardized tests, observations, and real world performance to understand how language disorders affect learning, communication, and social interactions. Um, Okay, the process. This should be very familiar to you guys by now. But we'll just to cover our bases, we're going to go through them. Kind of already touched on this, but we, for first of all, get consent, get the signed paper. We probably had an initial meeting, initial parent meeting. We might have already gone through response to intervention a couple of times. Parents, the teachers have given us data, and we're entering into that process. Um, so now is when we would maybe do that phone call with the parent, get the case history. We're going to email mom an interview. We're going to email teacher an interview, get that information back. We are going to do a classroom observation, or a clinic observation, even bonus points if we can get a playground observation, or specials just to kind of see them in the different settings. But it needs to be a naturalistic setting to see how they're functioning and using language, because that's something else that a lot of times, if we get a little short on time, we might overlook. There's a lot of kids who will test, and sometimes these tests are a little easy. Maybe their disorder is a little deeper into that third or fourth layer of language. So if you're asking, is this he or she? Is this is or are? They're going to pass, but that doesn't mean they don't have a language disorder. So I think these kind of naturalized, natural observations are really showing us, yeah, but how are they functionally using language? Is it actually impairing them? And you can use those observations. Again, I've said this a couple of times throughout the course, just whether written or in mini lectures. Um, these are great for borderline cases. If you're like, oh, I know this kid is struggling, they freaking passed the test and they passed it by like a point or two. It's like, but you're like, they're struggling. So this is when those observations are going to come in really handy. This is when that dynamic assessment is going to come in handy. These are when the interviews are going to come in handy because they can tip the scale. You can say, I am using my clinical judgment to say that despite these being 2 points too high for qualification, these other elements indicate the child is actually much more severely impacted than the scores were reflecting. Um, you need the standardized assessments. And then you want informal assessment, language sampling, um, functional assessments, just, determining how communication difficulties affect participation in academic, social, and daily life, daily activities. But again, that's kind of, that's from those naturalistic observations that we were talking about. And then when you put all that together, you are going, after combining data from multiple sources, you're going to find the nature of the disorder. Is it speech, language, expressive, receptive, pragmatic? Is there some voice and fluency stuff going on? Social communication. And don't forget, social communication pragmatic issues can be by themselves. So they could pass like a receptive language test and an expressive language test, but they could bomb a pragmatic test. And that is an area of language. They can qualify under that. So don't forget to kind of test that. That's something, again, like I said, the social, a lot of times it gets forgotten. But, autism is 1 in 36 now. It's 1 in 36 kids. That's almost one kid per elementary classroom for a big school. Definitely 1.5 for every two classrooms. So these kids are going to really break down in this area, and we need to be aware that this is kind of a common thing, and that's just autism. There's also some social communication disorder where the child doesn't have autism, but they have a social communication disorder. So that's another addition to the bucket of kids who might have pragmatic only issues. So we need to be testing for that. We're looking for severity, impacts on education, social, and daily functioning. And then we're using this information to design appropriate goals and intervention strategies. And I think in the schools they kind of do it like by school year, but they'll also have like kind of like quarterly objectives that we want to try to be like moving towards. Um, okay, comparisons of specific tests. We've talked about this a lot, but I'm just gonna do a quick review. So standardized tests, those are your self, owls, castle, the tops for pragmatic language, many, many more. But this is where we are using norm reference tests. So comparing our kid to the skills of same aged norms for other students. We're assessing the receptive, expressive, pragmatic, and comparing them to the age norms. They are sometimes quick, sometimes lengthy, but they're reliable. They are valid. They've been scientifically designed and tested, so we know that these are going to give us reliable and valid results. However, the problem is they may, I guess, like a downside is they might not reflect natural language use, cultural language use, and sometimes there's even like biases, like where was the test written? Is somebody from a different country or, kind of literary background gonna do as well as somebody with like a, Caucasian European descent background, So that's why we kind of do our other things just to double check. Language samples and conversation analysis. This evaluates spontaneous language and context. Like again, this might be different than how they display on the standardized assessment. That's why this is really important. And then we can now really see, how are they using morphemes? Are they putting the ES? Do they know that there's supposed to be an ES and an ED on the end of a word in the test? But are they using it? Syntax, semantics, pragmatics. So we're looking for all the same things, but we're seeing if they're actually using it. Or maybe they could use it when they're generating a response, but when you're talking to them and asking for a response, now all of a sudden we're taxing their brain too much and their language declines. We can kind of just pay attention to like what's going on. So this reflects their real life communication use. It's very flexible. It can be a little time consuming. A lot of times it requires transcribing, but this is where I say just use your cell phone, do that recording, and you don't need to go nuts. Like I said, depending on your school district or clinic, they might have norms. They might want a 30-minute sample or a 15-minute sample, but if you're short on time, if caseload is a thing, you can get a lot in like 10 minutes. It's just depending on how much they're giving you. If they're not giving you anything, you got to keep going. But if you have a really verbose child, they give you a lot in 5 minutes, then you can just kind of use your judgment for how much you actually need. So curriculum-based assessments, this is where we're measuring language difficulties and how they affect academic performance. So it's directly linked to school tasks, which is good, but has limited norm reference data, less standardized, and it's just kind of more for those academics. So again, that's kind of like a supplemental thing, and it just depends on if it's required where you're at. Dynamic assessment, we already talked about this, but we test for learning potential and responsiveness. And it really helps us to kind of see, are they going to respond well to therapy? Are they stimulable? Meaning, like when I coach them, are they able to kind of like benefit from therapy? And a lot of times, if the answer is yes, that if they're stimulable, like they can't do it, I model, I coach, they can do it, that doesn't necessarily mean that they shouldn't have therapy. If anything, it actually could mean they're going to do really well in therapy. And sometimes, if a child in both language and articulation, if they're just not stimulable at all, we're still going to qualify them, but it does give us like a kind of a heads up, like, ooh, they might not respond well to therapy. So it's just good for us to have that awareness in the back of our mind. Um, Dynamic assessment requires training, and it is less widely used in schools. I would say it's probably less widely used in schools because time constraints, because there's no reason why we wouldn't use this. It's beneficial. So if you just kind of develop your own little handy dandy way of doing a dynamic assessment and just make sure it's efficient and concise, this would be a really good thing to incorporate. Um, Okay. Observation checklists. Observations and checklists, again, evaluating language use in the natural setting, captures that functional and pragmatic, which is social communication skills, very easy to implement. It is subjective, so it requires our own kind of gut feeling or interpretation of what we're seeing, and it's definitely not standardized. Um, but that's not an issue if we've done standardized tests. This is that kind of valuable supplemental information that we're looking for. And then, of course, the parent teacher questionnaires, which we already talked about. And this it offers not only insight into everyday functioning, but everyday functioning in multiple settings with multiple people. So this is that kind of generalization category. Like they might do great with mom, or they might do great with their third grade teacher who was a special ed teacher for 30 years. But how are they doing everywhere else? And so it kind of gives us that kind of information. So in short, assessment is standardized tests, language samples and observation. So standardized tests give norm reference scores. Language samples and observations show real life performance. And curriculum and dynamic based assessments highlight functional impact and learning potential. And for evidence-based practice of school age learning assessments, I mean, we really just covered that. Standardized tests, naturalistic language samples, curriculum functional assessments, dynamic. We want multiple sources of data collection. And like a lot of times, like, if you don't have this, well, first of all, your school district is going to flag you and be like, why aren't you doing this? But you might hear from the insurance company. So we want to combine tests, observations, teacher parent report, language sample to create a comprehensive full profile for the student. And we need it to be data driven. Make a diagnostic decision based on data. And it also helps us with our goal setting, decision making, especially when we have multiple sources. We can understand like what we can design socially relevant, academically relevant goals based on what we're seeing. We always want our goals to be to improve the child's life. So if we're just like saying, oh, child will memorize this list of 50 words arbitrarily that I picked off the internet. Okay, well, that's not helpful, right? So it might be good to say, we're working on vocabulary, meet with a second grade teacher and say, child will, this is not a good SMART goal, just so you know, but it's just more conceptually think about it like this. Like child will, show progress in, second grade based vocabulary skills, with communication with the teacher, something like that. That is not a good SMART goal. We will get into SMART goals, but just kind of like what can we target is more kind of what I was trying to show you. But that's another thing, and I was guilty of this. A lot of these things I'm like, oh, I was guilty of this. Um, we like to work in silos, and we're busy, and it's just easier just to do our own thing. It's so good when we work with the teachers, and I sometimes did it and I sometimes didn't. But when you work with the teacher, you will create meaningful goals, meaningful interventions. The teacher will feel supported. Um, they are more likely to use interventions in the classroom to get that kind of generalization and continued therapy in the classroom setting. So when you can, it's really good to do it. And this is coming from someone who can always do it, but knew I should. Okay, so I think that's mainly it for this one. Again, simu cases and Calypso coming up. Um, it's great. It's pretty user friendly. It is technology, so use the helplines if you're struggling with technology. Luckily, I think you guys have another teacher who's kind of getting you started on this, so it should be familiar when we kind of get to ours. Um, they guide you through pretty well, but I just want to give you a heads up. They are time intensive, so I don't think that they're hard necessarily, but you just need to be aware and budget the time for it. And again, we have that mandatory meeting coming up that is mandatory. I cannot give you clinical clock hours unless we have a supervised encounter. So this is not just a waste of time. Like if you want those hours, we have to do it. And actually, I don't know if this has been brought to your attention yet, but for classes where the clock hours are required, um, I like 5:30, it's a required component. You need to get the clock hours to pass both your 5:30 CE class as well as 5:30. So please, please, please find a babysitter, get someone to cover your shift, ask for a day off if you have to, or 2 hours off because you have to come to one of the two sessions. We already have one booked, and I'm going to offer another one, but one of the two you got to come to. But that's my public service announcement on that. Hopefully, after this first class, this will become second nature to you guys, and hopefully, get a lot out of your clinical clock hours. So, good luck, and you got this.